This one says I have a persistent sore on the roof of my mouth. Could this be a sign of oral cancer?
So I have a persistent sore in the roof of my mouth, and could that be a sign of oral cancer? Absolutely. The answer is yes. The number one reason, if you go talk to anybody, any dentist, or we are going to say that when you have, we call it as a non-healing ulcer. So when you have a non-healing ulcer, that is one of the most common reasons to why you need to have that checked out, and that could be a reason you may have oral cancer or signs of oral cancer. Do you know what we do in our office?
We do biopsies.
There we go. Can you explain to them what a biopsy means?
So when we do a biopsy, we basically cut a piece of the gum, or is it the lesion,
Yeah.
and we send it off to a lab. They'll fax us back in the results, and we'll have you come back in, and the doctor will read the results out to you, basically letting you know if it is surgical or not surgical, cancerous or not.
Non-cancerous, right? So imagine, right? Imagine, like, let me give you an analogy. Like, let's say if you are a woman, for example, you had a lump in your breast, or like a small lump that you found. Like, your doctor is going to recommend, hey, I don't like the way that you have a lump and I don't feel comfortable leaving it. So I recommend we take a small sample of it, send it to the lab, have them look under the microscope, and then let's see whether it is cancerous or non-cancerous. Exactly the same thing in the mouth. If we have a really, really tiny ulcer, we completely excise it and we completely remove it and send it to the lab. Or if we have a bigger ulcer and we want to find out before we completely remove it, it is non-cancerous, so we take a small sample of it, we send it to the lab, have the lab tell us whether it is cancerous or non-cancerous. Depending on that, we take the next course of action.